Hi, I'm Dia Hamid, consultant psychologist of Haritham Child Development Centre, Calicut. What many of us think is what could possibly make a child depressed about. After all, when we were their age, we were carefree and happy. But times have changed. Even children are not immune to depression these days. What is most surprising is the fact that even children face feelings of hopelessness, sadness, and isolation just like we adults do. And understanding it at an early age is very crucial for the child's well development. Being in a depressed mood is more than sadness. What most of us use is being depressed and being sad as similar terms, but then actually it is different. Being sad is considered normal by the society. It is having a low mood or having a regret over something. But then, if the sadness persistently and consistently stays for a longer duration, then it is considered as a symptom of depression. Majorly, the symptoms of depressions can be classified as not enjoying or not being able to enjoy previously enjoyed activities, or having inward, that is being distracted by one's own thoughts, having negative thoughts about self and about the future in general, and also not being able to socially engage with others, being low on energy and motivation, not having interest over anything, having self doubt, feeling that you are inadequate, feeling that you're worthless, feeling hopelessness. These symptoms, when you're hearing for the first time, you might feel like this is some symptoms that I might face. Hearing these symptoms of depression, one might think this is something that I have, or this is something that I relate to when facing a situation. But then these symptoms alone is not a major concern. When these symptoms come along with various other symptoms, then it is a matter of fact to be looked upon. Symptoms of depression not only impairs our emotions but also affects our cognitive functions and our physical functions. Cognitive functions can include these intense emotions when we are facing. We might have impairments in our cognitive functions, such as our executive functions, our decision making, planning, in our concentration ability, in our memory, and also we'll be having slowed thinking. In general, we can say that when we are facing a sad situation, we might not be able to do the daily tasks that we do, right? Because our mind is not able to function properly. We are not able to make decisions properly. We are not able to grasp things as we normally do. This is how the symptoms of depression can affect our cognitive functioning. Now, how can it affect our physical functioning? When looking upon the physical functioning, we'll be having sleep disturbances. That is, when we are facing symptoms of depression, we might have insomnia or hypersomnia. Insomnia is a condition where you're not able to sleep, and hypersomnia is a condition where you're oversleeping. And when you're having symptoms of depression, when you're oversleeping too, you are not waking up as a fresh person. You might feel tired even after sleeping enough. Also, there'll be appetite changes. You will be not eating much or you will be overeating. These are the physical symptoms of depression. Now, while considering the symptoms of depression, we cannot diagnose a child having depression if the child is normally someone who is lacking motivation or someone who is not that active. That is how the temperament of the child is. But if the child was previously very energetic, very joyful child, and recently there is a shift in the normal pattern, the child have become inactive, the child has lost interest or motivation, then it can be diagnosed as the child having depression. The depressed mood in children and adolescents can often come across as irritability, which is considered as the prominent symptom of childhood depression. Also, they might have other features such as anhedonia, that is the feeling of not being able to enjoy activities like they used to previously. Also, they'll be having a lack of energy and motivation. They will not be able to put in much effort as they used to. They might have low performance in school. Even if they put in a little effort, they feel like they're doing too much. Also, they will be having negative thought about themselves. They'll be self-critical about themselves. They'll be having self-doubt. They will be preoccupied with negative thought such as I am not able to do anything right, I am not worth doing it, I am not lovable, I am not having any friends. All these thoughts can be preoccupied in them and they'll be distracted with their own negative thoughts. Also, they'll be losing the normal reactivity. We as human are capable of reacting to situations. But if you're someone who is depressed, your mood will be constructed, or it will be hyper reactivity. That is constructed in the sense that in situations you will not be able to react as much, or hyperactivity can lead to reacting too much. That is extreme reaction even to the slightest provocation that you get. Also, there will be changes in sleep and appetite. Sleep, it is either you are not sleeping at all or you're sleeping too much, and even after sleeping too much, you are tired. Also, there'll be change in appetite. That is, either you are eating too much or you are not eating at all. What can be considered as some of the causes of being depressed or childhood depression? There are multiple factors. We cannot say a single factor as a cause of leading to childhood depression. Some children have genes that make them more sensitive to depression. That is, they have a family history of depression. They have someone in the family members that is depressed or have mood disorders. Also, children might have faced some loss or a stressful event, a difficult event that they consider, that is loss of someone that they loved, parent separation, or they not performing well in school. All these can be considered as one of the cause that is leading to depression. A child being physically, emotionally, and sexually abused can also lead to being depressed later on. The therapy that is considered effective as the treatment for depression or childhood depression is CBT, which is cognitive behavioral therapy, where the therapist will sit with the child and let them speak out. That is, how they feel, how they think after establishing rapport. The therapy that is considered effective for depression or childhood depression is CBT, which is cognitive behavioral therapy. That is where a therapist will establish a rapport initially with the child and let the child speak out what the child feels or think when a certain situation happens. Now, what can a parent do to help a child when they know or when they understand that their child is facing depression? Sit and talk with the child about what the child is feeling, about what the child is going through. Let them know that you are seeing and you are understanding that they are going through something, and you are there to help them and help them heal with all the support, love, and care. And if you think you are not being able to help your child appropriately, take them to a child therapist. Child therapist is someone who deals with the children's mental health and well-being. Early intervention is important for the better treatment of childhood depression. Thank you. We'll be coming up with more videos covering various other topics.